Well, I guess the first thing about healthcare reform that I'd want everybody to understand, at least from my point of view, there are no holy grails. And we've spent decades in this country looking for sort of the magic bullet that would make our system sustainable and that would improve it. Triple Aim is really, in my view, a conceptual framework for thinking about healthcare differently. First and foremost, focused on the patient, so thinking about a better care experience for patients and how to deliver that. Secondly, thinking about better outcomes. So how do we use the healthcare system we have and other social programs that drive health status in our society? How do we use that to influence the health of our population over time? And then the third is better value. And that is a very legitimate consideration. In my province, in Alberta, we use about 45% of our government budget for healthcare. There are other jurisdictions in Canada that are getting very, very close to 50%. So why should we be concerned about that? First of all, it's a lot of money. And in the case of Alberta, it's over $17 billion. But secondly, the day that we see healthcare spending exceed 50% of government spending, is going to be a sad day, because healthcare at that point will have become an opportunity cost for things like education, for funding for our universities, for initiatives around the environment, for all kinds of other public services that Canadians depend on. So trying to get away a little bit from just thinking about healthcare as a value to thinking about it as a very important and scarce, increasingly scarce public good that's consuming more and more of our financial resources is important. We have to get serious about that if we want the system to be sustainable and to be here for future generations.